Hi, everyone. Thank you so much for joining us today. My name is Liz Smith, and I'm a Gunnison County Commissioner, and I'm thrilled to introduce our next presenter for our panel on transparency and accessibility, which is also a workshop, and wonderful because we don't often get to do things at these types of events. So I am very pleased to present Sarah Whaley, who is a Senior Practice Associate from the Johns Hopkins Bloomberg School of Public Health. Sarah Whaley is a senior, I just said that, and the director of programs of the Bloomberg Overdose Prevention Initiative at Johns Hopkins School of Public Health, with experience in both opioid treatment and harm reduction research and direct service intervention. Sarah's goal is to advocate policies that are rooted in evidence to improve the health and well-being of individuals who use drugs and their families. Let's welcome Sarah. Thank you.
Thanks, everybody. It's great to be here again. I'm strong. Commissioner said this is going to be interactive, which it is. So if you are sitting at a table by yourself, or there's just like one or two of you, I would really recommend finding some friends, some new friends, and joining another table. It's going to be a more fun time that we have together if you are amongst friends. So, yeah, get together. All right, while you all shift tables, I'm going to just outline what we're going to be talking about today. So this session is specifically on transparency and accessibility. We have talked a lot today. You've heard it mentioned at several other sessions about how Colorado is leading the way in so many ways for state and local governments across the country. And one of those ways is through transparency. You guys have a lot of great reporting requirements that the AG's office has outlined for you. But kind of in that, sometimes we have these requirements for reporting or transparency that we do because we're told we have to do it. And so what we're going to do in this session is kind of dig into why we're, look, 2 title slides, why we're doing what we're doing. So we're going to talk about what transparency is and what it means specifically for opioid settlement funds. We're going to do an activity. We're going to brief that activity, and then we're going to dig into specifics around data for transparency and around like what to report and why we're reporting it. If we have time, we're going to do another activity, and then we're going to close out with a reflection. So I hope everybody brought their like participation pants today because I really want you guys to have a good time and to interact with each other. This is a session we're going to learn from each other. So what is transparency? Any volunteers to tell us what is transparency? Meaning what you say, wait, saying what you mean and meaning what you say. Yep, great. Sharing information. Yes. Saying what you know and don't know. I love that one. All right. Definition, transparency, is the quality of being easy to perceive or detect, but there's also some other things that we've talked that you guys mentioned kind of in there. Being transparent, oh, that's the word. Being open, sharing what you know. I really like the sharing what you don't know, because part of transparency is like opening yourself up to criticism, right? Which we like don't like a lot, but like putting all of your cards on the table. Kristen mentioned in the last session, I don't know who else was in here, but there is a lot of buzz around settlement funds across the country. Folks are talking about it, reporters are digging into it. There's different types of reporting. Some reporting is highlighting amazing work that's being done, innovations, all of that. Then there's the other side of reporting that is like, I broke the microphone. There's the other side of the reporting that is that like gotcha journalism, right? They're like digging into what you're doing and trying to find the flaws. But I think a part of transparency is like controlling the narrative, right? If you put it all out to be like, here are the things we know and the things that we don't know, you're kind of driving the bus instead of having somebody else like open up to write your narrative for you. So what this means specifically to opioid settlement funds, there's a couple pieces of this. So there's the financial piece. So like how much money are you getting? Where's that money going? It's like following the dollar signs. Then it's like the process. Who's making the decisions? Why did they make that decision? And then what did that decision do? What were like the outcomes? This is not an equal sign, but it was supposed to be. Together, all of these things come together to increase trust with your constituents, with your partners, with the other regions, with the AG's office. Transparency helps to promote trust. It also helps us make informed decisions. If we know what our neighbor is doing, maybe we won't do that because that would be duplicative, or maybe we could work together. So it helps us make better decisions when we have all of the information. It also helps with that risk mitigation. So getting ahead of someone else writing your story for you, but also kind of other pieces of risk mitigation. If you know all of the things, if your neighbor knows, it kind of helps us get ahead of certain things. I should have brought the clicker with me. This is not my first time presenting, but even though it might seem like that. Okay, so within this, with settlement funds, there's levels of transparency. We have what's required. So within the national settlements, there is required reporting. State and local jurisdictions are required to report out any non-opioid expenditures, right? You have to report that out to the settlement administrator, Brown Greer, or you should be. And then also within Colorado, there's reporting requirements. So that's what's required of us. This is the bare minimum of transparency, right? Then, way on the other side, we have our gold star of transparency. What's that gold star? What's like the most transparent transparency ever? It depends, I think, on what our priorities are and some other stuff. So, our first activity is thinking about, on this continuum of like, the bar is down here to our gold star. In the plastic cup on your table, you have a series of activities that state and local jurisdictions are doing, have proposed doing, maybe aren't doing. Those activities, what I would love for you to do is to take a couple minutes to read through those activities and put them in order from this is the most transparent of an activity to this is the bare minimum kind of transparency activity. Is that clear instructions? Any questions? Okay, take a couple minutes together and try to come to a consensus in your group. Do we need more time? Does everybody have theirs done? You guys are good? Can I get a thumbs up from tables if we're done? Ish? Okay, do you want one more minute? Okay, one more minute for the table in the middle. All right, let's everybody come back and focus. All right, I'm gonna ask some tables, and if you don't volunteer, I'll volunteer you, but would love to hear how this activity went. So anybody willing to kind of share how the process was? I'll ask you some pointed questions. All right, table in the back. I'm running a microphone to you. Okay. Yeah.
I don't know if our order is totally right. There was a lot of discussion involved, and there were a lot of qualifying words on each of our pieces of paper that changed how transparent we felt that it was. So what does an open meeting to the public mean? Who are the public, right? Like, is this our advisory members, or is this just a lay person? So we got really stuck in weeds trying to determine the details that made something more or less transparent, and I hope that's kind of a point that you're trying to make.
Exactly, yes.
Okay.
I think, so you said, I don't know if we did it right, so I bet if we went around to all the tables, if we had time, we would like report out where we put everything, but I don't think we have time for that. Because I think what we would find is that there's variation. And again, this is like based on interest. So I've done this same workshop with a group that was like community-based organizations and folks from different states and local government. And there was a lot of like back and forth because folks at the community level were like, well, we want to know everything. And the state folks had like different things that they felt were like transparent, right? So like it depends on what our motivations are, what our interests are, things like that. So I think there would be a lot of variation. So thank you. And I loved the like qualifying words part. A lot of these might be similar, but there's like additional words in there. Can you tell us what was your most transparent and what was your least transparent activity?
Okay, so we thought least transparent was just posting how much money the state has received to date from each settlement on a website.
Okay.
Lots of discussion around what was the most transparent. We're kind of, well, no, let's go with this, okay? Okay. We've been creating an externally facing platform that tracks OSS budget and reports on output data from each program. And we felt like the program data.
Yeah. Yeah, some output data, publicly facing output data. Great. What about another table? This group called themselves powerhouses, so I feel like they have to. Jamie said that. Okay, Team Powerhouse. How did it go for you?
We didn't say that. Jamie said that, by the way. Something that, well, we put as our most transparent to have public meetings, that whole one. And just how, like, you can control the narrative to an extent when you're, like, being transparent and you're sharing all the information you have. But to actually make accessible the iterative process of who was in the room, what kind of discussion was there, what information did people have when they made a decision, feels so important. And sometimes, especially as like public officials, that can be very vulnerable because, you know, the public gets to see all the ins and outs of how decisions are made, but that feels extremely important to maintain trust with the community. We're not having behind closed doors decision making about how the funds are spent.
Yeah, I think that's a great point. And do folks feel like with this money specifically that there is like that extra layer of necessity to disclose to the public about what we're doing? Do people feel that way? Maybe more so than like other funding streams because of like why we have this money? right? So, and I think that's why there's like this spotlight on opioid settlements, like with all of the reporting and stuff, is because of like the reason we have this money. So there is this like extra layer of obligation to be transparent. But again, transparency is not black and white. There's a lot of kind of nuance and variation, and it depends. So anybody else want to share? What were you said public meetings, and least transparent was?
Recording non-opioid funded things.
Oh. Okay, reporting that, yeah, the like bare minimum. All right, one more group. Oh, yeah. I love that, yeah.
So we went from like creating to sharing things outward in terms of least to most.
Yes. I think sometimes things are created and then they just like fall into the echo chamber of like, oh, we hashtag did a thing, right? Like, but how can that be used? Why is it useful? Yeah. Table up front, a hand? Yes, it checks a box, but maybe isn't the most useful. Okay. Okay, closed out. All right, now we're gonna move into data. So if we're collecting information that we like want to be transparent later down the line, what are kind of some of the things, what are these data pieces? So we're gonna move through this like building blocks for reporting. So the first tier, and we can think about it kind of also along our continuum of transparency. Wait, why is that one? Okay, here, I clicked too much. We're gonna start with our like input. So what are the things that are like coming into our jurisdiction or into our community? And this is like the money received, right? Kristen mentioned in the last session that we are working with KFF Health News, so Johns Hopkins, Shatterproof, and KFF are looking at any kind of publicly reported information for settlements. And I was shocked at how hard this like first piece of information was to find. Are there folks in here that are like county commissioners or on the regional boards? Yeah? Is it easy for you to know how much money you're getting? Like, do you know? No. Yeah, so this is like, when we talked about bare minimum, it was someone said the amount of money that you're getting. Bare minimum should be reporting. But if the people that should know don't know, we're in a pickle, right? So that's hard. We're here at the beginning and it's still a struggle. So I think in thinking about if we want to be transparent to the community, but we don't have that information yet, like thinking about how we can advocate to the AG's office, Jamie left, but in like making sure we know this information, right? This is the bare minimum. We want to share it. We want to be transparent, but we don't even have this information yet. Yeah.
I think we do on the AG's website. It's pretty clear. It's got the state map and it says region by region how much everybody has received. I think that I was getting a little tripped up by the way that this work intersects with so many other pieces of work across the state that are housed separately, whether it's the BHA or CDPHE. And so that's where, for me, it gets tricky. But I think that the reporting that we do makes it very, very clear what we've received and what it went to.
Could everybody hear that? Yeah. So the point I want to make here is that like if we're working towards that gold star, like I just want to acknowledge that like Kristen and I at the national level are looking at what you guys are doing, but we also are acknowledging that like this is a fully new way of thinking about things, and we are all building the process as we're going. And like just want to give grace and acknowledgement to all of the work that you are doing, that like we're here and it's hard. So just in your advocacy, like that to me should be like maybe an easy fix, should be an easy fix. Yeah. Mm-hmm. It's not. It's not. Jamie was in my workshop in New York City, and she was saying that like for the state, they'll get, you know, a deposit from the National Settlement Advisor or whatever. What are they called? The settlement. And it'll be different than what's like reported on the website or what they were told they were getting. So like there's issues like from step one. But we're learning and we're growing. Okay. Next step is once we have kind of the information around how much we've received, then there's the money that goes out the door. So we're making investments in programs. And so that the building block of that to report out, we would want to know like what was funded, what was invested in, for how much money, and to do what, right? In some of these state reports or jurisdiction reports from across the country, there's a dollar amount, and sometimes there's a recipient, and even less often it's like, why? So in thinking about how we're being transparent, making sure that we like hit all of these pieces, and I think the like to do what is a really important one. If we're giving money to the local behavioral health authority, what is it exactly that they are going to do with it, right? This is one of the accountability pieces, how we figure out that like, or get around the risk mitigation, how we make sure we're not mismanaging these dollars, that they are going to the things that like they're supposed to go to. And part of that is like saying what the money is going to. Any thoughts or questions on this piece? No. Okay. Once folks have the money, so we like give a program some money. The output is what did that program do with it? They said the program was gonna, you know, increase naloxone into the community. So what did they do to do that? Did they hold public education events? Did they do outreach where they passed out naloxone to people, the most affected people? And then did those programs meet their targets? Did they get into those communities? Or did they give out naloxone, but they just like went to the sheriff's department and were like, here, right? So like making sure that the outputs are aligned with these pieces, right? If a program says they're gonna do something, make sure that the output is aligned with that. How hard is this? Why? Yeah, tell us more about that.
We've also just found it's really hard sometimes to separate what's like a data metric, something that we can collect, versus what is an actual outcome that this project is trying to like have. What is to evaluate a program based on what they identify as a success, rather than kind of the same old metrics that we might use for another kind of program that might seem similar. So those don't always align in the way that we expect them to. Like number of Narcan kits distributed is an interesting data point, but that might not, a higher number might not necessarily mean success.
Yes.
If we're trying to reach.
You know, like pairing that with not just how many doses did you give out, but how many lives did you save? So kind of pairing those data.
Yeah.
Points, I guess.
Yeah.
So hard. It's so hard.
It is very hard. And I think a point that you made that I want to come back to is for a lot of these like community organizations that might be receiving grants, but also like systems, right? Health departments or other, there are so many funding streams. And these dollars might be used in addition to different funding streams. So when we're thinking about like what outputs we're asking them to report back on, what are they already reporting on? And how to align that so we're not asking for like different data points. And also like trying to make sure that we're matching the like output data to, you know, what they said they were gonna do, and making sure that we're like working with these organizations to kind of streamline some of this. Any other thoughts? Yes.
I mean, the things that we're discussing, it's just like evaluation is tricky.
Yes.
You know, like I think it's not just for our opioid state funds, but like any program evaluation would go through this logic model, and we're going to have the same challenges of like, does outputs in Denver, is that as successful as outputs in northern Colorado? Like we have different denominators, different populations, and then the outcomes. And for a lot of us nonprofits to be able to track down the road all the way what the outcome was for those folks, it takes more time and energy and resources than anybody has.
Yes. Yeah. And I think, you know, the outcomes piece, and I'm not trying to volunteer the state to do this, but, you know, I think this is something that is like really hard on the programmatic level to look at changes over time. And that, you know, could be something that at the state level they look at, right? If there's, what? Oh, okay.
Well, now I've just totally interrupted your flow.
No, please have your comment.
I feel like what I'm saying is exactly where you were going with this, but Brooke brought up a really interesting point, and I feel like not only is evaluation tough, outcome evaluations are particularly tough when we're thinking about substance use, because we all know prevention gets us the most bang for our buck, best return on our investment. We talk about that all the time, but how does one, within a 2-year plan, show the impact of a prevention program where your outcome data are like 5, 10, 20 years down the line? So suddenly we don't like feel transparent. We don't really know the impact that we're having as we try to overlay eval on the 2-year iterative process that is this opioid settlement funding.
Yes. Great comment. Yes.
Like what you were saying about just we started with, we're going to keep it really simple, and it might be too simple, but in the grants, we just took the wording directly out of Exhibit E when we created our grant applications and did the intake for those folks. So if they were looking at a particular area, that we would start with that wording. So that's very tactical, and it's not very interesting or like impactful from the outcomes right now. But our goal is just to make sure that when we as the staff go to put it in the cost system for the state, when we have to report on the outcomes of these grants, that there will be at least the same words. So we're kind of teaching our grant recipients about the words that we have to abide by asking them to do that. And then we just said we're going to ask for one little story from their perspective about it that will be our qualitative to start. And then we can always complicate it and make it more when we know more. But we know about as much as maybe the grant applicants know at this point. That, again, we're not sure, but we'll let people know.
Yeah, I mean, 2 years of outcome, like 2 years to get to an outcome is really hard. But I love the addition of a qualitative piece to add what success looked like and what outcomes you saw like in a qualitative sense. I think that's a really great way of navigating that piece. And you know, as we're thinking about reporting, really stressing that like outcomes are really time sensitive, and they also are like dependent on a lot of other things. And so when we're thinking about, you know, what the program was funded to do and what the outputs are going to be and what the outcomes may be, really thinking about attainable outcomes that like, it's hard to like get away from this, but like thinking about what environmental factors like might be contributing to some of that. So if we look at like lives saved from overdose reversals. A lot of that information is really hard to get. So that might not be like the best measure, is like how many non-fatal overdoses were reversed. Like that's really hard to collect at a programmatic level. Or if we're thinking broader, like number of lives saved, like how do we know that? And it's hard to estimate at a program level. So making sure that our outputs and our outcomes are attainable to the program. I think like bringing it back and simplifying it, as you've done, is a really good suggestion. Also thinking about, we get to our next one, impacts. They're like really long-term impacts of a program. And this one I think also is hard because we're thinking about, again, environmental factors. If we're thinking about, overdose rates, there's a lot of things that can contribute to that is outside of our control at the programmatic level, at the financial investment level. Who could have seen COVID coming, right? And that had a huge impact on our overdose numbers. And so if we were looking solely at overdose deaths as a metric to our success in the state of Colorado or across the country, that might not be the measure of success to look at. So again, thinking about how we're framing this and how we want to report out on the story of our investments, making sure that our outputs, outcomes, and impact measures are ones that are really going to tell the story. And then I think over time, as we're moving through this, again, is it building the plane as we fly? Is that the saying? As we're doing that, sharing out how it's going. There's going to be bumps in the road. We're going to do things maybe not so great the first time around. Learning from our mistakes, or maybe not even mistakes, just like learning as we go. And I'll use Maryland as an example. I live in Maryland, and Maryland, I think, has like 4 bills now that they have passed around settlements. They were like, yes, we're doing great. Dedicated fund for our money to go in. Woohoo. Great. And then they were like, oh no, we need to have a board. So then the next year there was like a new piece of legislation creating a settlement advisory board. And then they just passed another one this past year being like, we need the local governments to also report out, because there was only mandates in the first pieces of legislation. So Maryland is like learning as they go, and what process they had 2 years ago, they have already learned, like, we have to make some changes. We can do better than what was originally outlined. And so they've continued to kind of codify new processes as they've seen, which I think is like an interesting way of, we don't have to like be perfect the first go around. We want to try to be as perfect as we can, but like it's okay to be like, oh, we can do better. Thoughts on these building blocks of how we get to our gold star? Jamie put this slide in. As folks are thinking about those outcome measures and what outcome indicators, outcome measures might be useful if you're developing an RFP, if you're sending some money to a community-based organization, this tool called Osprey is on our Opioid Settlement Principles website, opioidprinciples.jhsph.edu. It is a set of measures that you can kind of go in and narrow down, filter down the measure that might be most appropriate to the program or intervention that you are looking to fund. Jose Escobar and Jamie were both folks who piloted this tool for us. They helped us build this set of measures. It is not an exhaustive list of measures, so there might be things in here, or there might be things that are not in here. There probably are things that are not in here, but we wanted to get something out and not spend the next 4 years trying to build like the most exhaustive database. There is a new tool similar to this, another list of measures that is coming out either at the end of December or January from the CDC Foundation that is like more targeted towards local health departments. So if that is you might have to wait a couple months, but this might still be a good jumping off point for you to just explore some attainable metrics for your output data. Okay. As we're moving through this, again, we're building the plane as we're flying. And someone already mentioned this, kind of where they are. Phases. as we're planning, the pieces that we need to report out, or that we might need to report out, again, are like the amounts. Also, the needs of our community. We want to make sure that our investments are aligned with what the needs of our community are. So doing a needs assessment, making that public, and then what kind of things that we're funding, or our plan for how we're going to meet those needs. All of that is kind of our planning phase. As we move out of planning and into action, this is when we're starting to make some investments, where we are giving funds to awardees. Who are the players in this decision making? And reporting back out kind of how these investments are aligning with the needs. And then after we've invested in some programs, we will get to this monitoring and evaluation phase, where we are reporting out to the public what the outputs of these programs were over time, what the outcomes were, and even longer over time, what are the impacts. But we can't get to that like impacts piece if we don't have good output data. So I think really thinking about when you're building your RFPs to like think about what are the things you'll want to report out on, what are the impacts, and those impacts should also tie back into your like needs assessment and your plan, right? So all of these kind of go and flow together. And we all might be at different stages of this. Okay, are we ready for another activity? Yeah, okay. This one might depend on kind of where you are, but I would love for in your table for you to discuss either at your local jurisdiction, in your region, at your community-based organization, wherever you come from, 3 activities that you are doing or that you would like to do to increase transparency and how you are implementing that. So we want the actual activity, and you could maybe borrow from some of the ones on your table, and then what you're doing. So what are the actual actions that need to take place in order to make that happen? So if you're building a dashboard, how does that happen? Clear instructions, any questions? Okay, 5 minutes. Okay, let's finish up our conversation and come back together. All right. We've got just a couple minutes left together, so I would love to hear from a group we haven't heard from yet. Great. I would love to hear from a group we haven't heard from yet about what is one activity that you are doing or hope to do, and how are you going to implement it? Any volunteers?
My group has voluntold me.
Okay.
No, we were talking about just some of the challenges that I thought were surprising from the outset, being in a rural region of 6 counties. Just the baseline of trying to figure out our resource mapping, what currently exists on multiple levels, whether it's treatment beds. It's hard to do needs and gaps when you don't really understand your current infrastructure and when counties can be in such different places. And then we have all the geographical challenges to boot. And so just resource mapping seems like a really foundational piece to plan for that transparency, so that, because then it becomes clearer that what you're investing your dollars into, which are limited, are really the things that are going to have the most impact or that are most needed.
Yeah, I love that. In resource mapping, can I ask about the implementation of that? Who is doing that?
I don't know if I'm going to get in trouble. I mean, we have multiple agencies across the state, and this is where I feel like some of the challenges are, because, we do have a behavioral health administration, which seems like a logical place to have some of this information. It is also relatively new, and what we're doing is relatively new, and so we're doing it all newly together. But I would think some collaboration with the BHA would be appropriate.
Anyone have any thoughts on that? Other folks thinking about resource mapping? No. Just you guys. Yeah.
I feel like I'm kind of causing trouble. Yes, resource mapping, excellent activity, very helpful for transparency. I struggle in this ROAC work occasionally with mapping this out because people don't seek services in our opioid settlement regions. And so resource mapping is awesome, but to your point, Liz, we kind of need a top-down map outlining resources across 19 regions so that we don't kind of get siloed in our little regional resource map approach, especially for rural communities.
I would echo that. I would just say we did ours through a feasibility study. So we actually had consultants that was a specificity within that feasibility study to go in and resource map for us for 5 counties. And then we had them bring it back and we gave it to all the people and, additionally the council to see, is this right? So it was very interesting to see what the consultants found and then what the perception of the council and just the people in our region were. So I do think it's a conundrum. Not that it was totally far off or anything, but there were some intricacies there that didn't map up. Mm-hmm.
Super interesting. And I'm hearing that, as we're thinking about transparency, to the public, there's also at the decision maker level, right, a need for transparency as well. So thinking about how transparency kind of ebbs and flows into all of these different places and stakeholder groups, we want to get it out to the public, but I think also realizing that throughout we need more transparency and more information. We are at time, but if you guys would humor me for 30 seconds, I would love to hear kind of anything that you are taking away from this session. If there are any volunteers that have either learned something or are taking something out of this room with them from this session.
I want to say I loved your picture of transparency and that continuum of transparency. For me, that was just a great visual of where we're trying to head with this. And I would love that slide. I hope that'll get sent out after this conference.
Pretty sure Jamie will share everything with everyone. Thank you. Please.
I think I greatly appreciate this particular presentation. I monitor the press in terms of the criticism of other states and the lack of transparency, and so many other states are failing horribly. Or you see these really bad headlines, all of a sudden the police departments have millions of dollars and nobody knows why. So as challenging as this is, I'm just really pleased that people are taking the time to really think this through. How does this look? We've got some time. Hopefully we can figure this out in the short run because we still have 16 years of work to do. But the more that you all can do to continue to think about this, the better in terms of being accountable to the public and then potentially also to really achieving the goals that we want to achieve with this funding. So thanks, Sarah, and thanks, folks.
Thank you. And I think on that note, you said it better than I could. So thank you all for all of the great work that you are doing, and keep it up. And I guess my contact info is somewhere. Nope. I will be here if you have any questions or comments, and I'm sure my contact info is like somewhere, but I will give it to you too. All right. Thanks, everybody.